my name is Ariana, and I know that you just had your baby a couple days ago, so today I will help you with the teaching on how to care for yourself and your baby. Are you excited?
Yes.
Okay, so first you will experience bleeding, which it will change from red to brown and to white. So that's normal. And then it will last up to 6 weeks after birth. And it will increase if you're laying down when you're breastfeeding. So past a blood clot is expected. However, it should become smaller and less frequent. So pedicare, in the first 12 to 24 hours after birth, apply an ice pack to reduce swelling. And also clean from front to back to prevent infection. Also use a warm squirt bottle to prevent stinging, and sieve baths with warm water may help with soreness. If you experience pain, apply witch hazel compression and anesthetic numbing spray or ointment. Since you got an episiotomy, here are a few things you should know in addition to pedicare. So stitches dissolve on their own after a few weeks. So try to rest as much as you can and report any pain that doesn't resolve with pain medication. If you having some full smelling drainage, redness, or edema. Do you plan to breastfeed?
Yes.
Perfect. So breast care. So also clean your hands before breastfeeding to prevent infection. Allow the baby to nurse on demand, which will be 8 to 12 times in 24 period. Feed until the breast is soft. And breastfeed can feel tender but should not be painful. If tenderness continues after 30 to 60 seconds, change positions. If your milk duct gets clogged, it can lead to mastitis. Treat it, massage it, and apply heat. Try to nurse on the blocked duct more and avoid wearing wire bras. Remember to drink adequate fluids, and you should contact the doctor when nipples are cracked or sore, red, shiny, which can mean yeast infection. And also, if it's painful, red on your breast with fever, flu-like symptoms, it can mean mastitis. And also, activity. So you should avoid any heavy lifting, everything that is heavier than the baby you should not carry. Because you had a vaginal birth, you should limit stair climbing for the first weeks. And also, you need to get rest. So plan at least one daily rest period. I will encourage you to perform pelvic tilt exercise to strengthen the back muscle and relieve strain on the lower back. Also, perineal exercises like Kegels.
But can I drive?
Because you have a vaginal birth, you may drive. So when you feel comfortable or when you stop taking your pain medication, because pain medication can make you drowsy. Another thing is postpartum depression. It can happen to some moms. So some symptoms that usually appear in the first 3 months, but can appear at any time during the first year, is possible thoughts of harming the baby or yourself, loss of interest, joy or pressure in things you enjoy, feeling of guilt, shame or hopelessness, crying, sadness, sleep disturbances, lack of appetite, lack of interest in the baby. These are symptoms of postpartum depression. And you should return to the doctor for a checkup. After a vaginal delivery, you should schedule a follow-up 4 to 6 weeks postpartum. Also, some symptoms that require immediate medical attention are urination with burning, pain, frequency, or urgency. If you experience abdominal or pelvic area tenderness or pain, breast with localized pain, tenderness, redness, or swelling, increased amount of discharge, large clots, bright red bleeding, full odor, Or if you're having some fever greater than 100.4, 24 hours post-delivery, and coughs with localized pain, tenderness, redness, warmth, or you experience an episiotomy pain that doesn't resolve with pain medication, or you having full smell and drainage or redness. So now we're going to talk about your baby, how to care for your baby. So feeding a normal daily intake. So colostrum is secreted during the first to third day of postpartum. And breastfeeding is recommended exclusively for the first 6 months of life. Newborns should be breastfeeding every 2 to 3 hours. So you should wake up the baby to feed at least every 3 hours during the day or every 4 hours during the night also. So the normal daily output, so wet diapers per day. So day 1 should be 1 or more, day 2 should be 2 and more, day 3 should be 3 or more, and day 4 should be 5 or more, and then should be 6 or more per day. And the dirty diapers, so day 1 should be 1 or more, day 2 should be 2, day 3 should be 3, and then after day 3 should be 4 dirty diapers per day. And stool should be at least the size of a quarter to be counted. So how to care for the umbilical cord? So it should look clean and dry always. You should dress your newborn in loose clothing so air can get to the cord. Also, fold diapers down so they don't rub against the cord. So also avoid the temptation to help your child's cord fall off by pulling on it. It will fall off on its own in about 1 to 3 weeks, so do not pull on it. A little blood is expected. So bathing and skincare. So newborn's temperature at least 97.7 before beginning bath. So water temperature at least 100.4 before beginning bath. So make sure to test the water with your elbow. So do not submerge until the umbilical cord has fallen off. Do not bath the baby after feedings to prevent vomiting. And never leave a newborn in tub or sink. This might sound obvious, but it could happen. Shaken baby syndrome. Some symptoms are lethargy, trouble breathing, vomiting, coma. Sometimes caregiver reacts in anger or frustration because the baby will not stop crying, but you should never shake, throw, hit, or slam a baby. Some alternatives are like take a deep breath and count to 10. Place the baby in a crib and leave the room for like 10-15 minutes. Call a friend, family, or parent hotline for emotional support. Some types of soothing techniques are like touch, like skin to skin, like massage. And another one is movement, so rock or gently sway, or go on a walk with the baby. Also, like maybe you should put like some music that might help. And maybe it's just because your child needs a diaper change, needs to burp, or just to swallow. So I also want to talk about sudden infant death syndrome, SIDS. It's the sudden and unexpected death of a baby less than 1 year old. Some causes are accidental suffocation, entrapment, strangulation in a sleep environment, death from unknown causes. To reduce the risk, tummy time, breastfeeding, checkups. Also, promote safe sleeping. You can remember these are ABC. A for alone. A baby should never sleep alone, at least for the first 6 months and ideally for the year. Use wearable blankets or sleep sack if you think your baby is cold. For B is for back. So they should sleep on their back always. And C is for crib. So they should sleep on a crib. Place away from furniture, window, blinds, or drapery cords. Also, avoid overheating and smoking. So now we're going to talk about thermoregulation. What is normal and abnormal? So normal for babies in the armpit is 97.7 to 98.6. Abnormal will be less than 97.7. You can also take your baby's temperature rectally.
But how can I take the temperature of my baby?
So there are two ways. On the armpit, so you place the silver end in the middle of your baby's armpit. Hold your baby's arm firmly against their body until the thermometer beeps, and then you check the reading. And then rectally is coat the tip with petroleum jelly. Place your baby on their back with knees bent on their belly. Gently insert the thermometer 1.5 to 1 inch into their anus. Leave the thermometer in place until it beeps. Afterwards, clean the thermometer before and after use with soap and water. Also, your baby can experience jaundice. Jaundice will be assessed during hospital stay and at first well baby check. Some symptoms are white in their eyes, they look yellow. It's because of the buildup of bilirubin, a pigment in the blood. Also, not enough amount of stool per day, and not feeding well or sleepy. Bilirubin is passed in the baby's stool and urine, so frequently breastfeeds to treat it. Now about car seat safety. Place rear-facing car seat in the back, preferably in the middle to avoid airbags and side impacts. Keep babies in rear-facing car seat until the age of 2 or infant reaches maximum height and weight. So how to prevent infection? Always use proper hand hygiene. Do not allow people around your baby who have contagious illness, examples cold, flu, or strep. Make sure you and all your baby caregivers, including grandparents, are vaccinated for pertussis, whooping cough. Airway clearance. So to help clear the fluids and mucus for the lungs, hold your baby upright, support their head or neck, and gently pat on their back. If gag continues, place baby's tummy down on your lap or forearm with their head lower than their body and pat on their back while keeping a good hold on their chest and shoulders. So how to use the bulb syringe? Avoid overuse because it can lead to nasal swelling. Lay your baby down with their head turned to the side. Squeeze the bulb first, then gently place the tip inside the nose or mouth where you see excess mucus. Release the bulb slowly to pull the fluid in. Squeeze the bulb in a tissue to clear the syringe. Repeat as necessary. Finally, wash the syringe with warm, soapy water. Contact your provider if your baby seems to be having serious difficulty breathing, blue lips, tongue, or mouth. So, some signs and symptoms of infection in a newborn are feeding intolerance, apnea, tachypnea, tachycardia, bradycardia, cyanosis, irritability, lethargy, temperature instability. Also, some symptoms that require immediate medical attention is temperature greater than 100.4 or less than 97.9, poor feeding, forceful vomiting, decreased urination, diarrhea, labor breathing, if you see flared nostrils or absence of breathing greater than 15 seconds, jaundice, cyanosis, lethargy, inconceivable crying, bleeding or purulent drainage from or around the umbilical cord, drainage developing from eyes. So, routine follow-up appointments. 1 to 3 days after leaving the hospital, 1 to 2 weeks after birth, 4 weeks after birth, and at 2 months, 4 months, 6 months, and beyond. Some vaccines are hepatitis B, RV, DTaP, PCV, IPV, and influenza. Do you have any more questions for me?
No, thank you.
Okay, so everything that I say is gonna be printed for you, so you can take it home
Okay.
and just take a look at it. Okay?
Okay. Thank you.
You're welcome.